Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold, and I'm here with Dr. Gayatri Jape. Welcome, Gayatri. It's wonderful to have you here.
Thank you, Christine.
It's wonderful to have you back. You've been with us at Gold, and we love the knowledge that you share. And so we invited you back this time for the add-on package for the Midwifery Conference. And the add-on package, which is a lecture pack, is titled Comprehensive Care for 6 Newborn Challenges. And yours is critical congenital heart disease, right?
Yes, thank you. Yeah.
That's wonderful to have you here. And before we jump into the topic, Gayatri, tell us a little bit about yourself. First of all, where in the world are you? And tell us a little bit about your background and, where you work and, before we jump into the topic.
Thanks, Christine. So I'm from down under, so from Western Australia, which is Perth, and I work for the Tertiary Referral Institute here, which is King Edward Memorial Hospital. And we have almost 5,000 to 6,000 deliveries with almost 120 babies born below 28 weeks every year. So we have the largest maternal fetal medicine center as well in Western Australia. And for those who may have read about Western Australia, it has a very complex geographical location with, women being flown from different parts of Western Australia, almost very long distances to travel to reach the tertiary center. So so that's where I'm from. I have been a neonatologist and in the field of pediatrics and neonatology now almost 20 years this year. So has been an incredible journey. Obviously, continuing my journey with learning and helping small babies as well as their families to survive and thrive, as we call. Yep. So it's been. I think I'm very honored and privileged. I wouldn't bat an eyelid not to choose this job again if given the opportunity.
Beautiful. Well, thank you so much for sharing that. Yeah, that's a huge center you work at, huge hospital. It's so many babies, so many women to be flown in, babies flown in also from remote areas, I imagine, right? You've been with us for the Gold Neonatal Conference. Your field of expertise, of course, is enteral nutrition. You're very passionate about nutrition, breast milk, human milk, and preemie babies as well. And I know last time, after the neonatal conference, you and I chatted and we talked about, the midwifery conference. And I said, Gayatri, you have so much wonderful knowledge to share because this is not only for neonatal nurses and neonatologists, but also for anybody who's involved with the care of pregnant women and babies. So that's how we got started into bringing you into the midwifery conference and also the topic of critical congenital heart disease. So talk a little bit about that and what you hope our viewers will learn from you there.
Yes, absolutely, Christine. Thank you because you summarized it so beautifully. So I think anyone who takes care of babies and mothers is definitely and very much welcome to actually to learn about this topic. So it's congenital heart disease is actually the commonest abnormality which is seen in newborn babies, and almost 10% of all infant deaths and 46% of all deaths which are related to congenital problems or malformations are because of congenital heart disease. And you would be surprised to know that almost 2.4 million adults in the USA and around 12 million globally, they are survivors of congenital heart disease. So we are going to see this, in more and more adults who present with congenital heart disease, or moms who have had congenital heart disease who present with a pregnancy. So, like we should be very much ready to, to have a plan to deal with these complex patients as well. And although mortality has reduced significantly in the last sort of 15 to 20 years because of advances made with management, particularly availability of surgical procedures or early fetal echocardiography or interventions, it still remains up to around 34.5% globally. So I think it's a very important topic, and everyone, as I mentioned earlier, including midwives, nurses, neonatologists, pediatricians, we should all have a good idea about, what
Hmm.
we can do to, overall optimize the management of a mother who has a pregnant fetus.
Hmm.
Sorry, a mother who is pregnant with a fetus having congenital heart disease. Sorry, yeah.
Hmm. Yeah,
Yes.
being prepared, and also, sometimes I feel like as care providers rely a lot on, okay, on the ultrasound, and we think yes, everything will be detected there, but sometimes, we run into the situation, we have a baby that's born, and we look at the baby and go like, something is not quite right with this baby, and it turns out
Yes.
in some cases congenital heart disease,
Yes.
and so it's vital, even if we think, oh, everybody or almost everyone has maybe an ultrasound, everything is being checked. There can definitely be quite a few cases where maybe the patient didn't have prenatal care for some reason, didn't have
Yeah.
access to care, did not get the ultrasound, or maybe it was not detected at that time,
Mm.
and that happens quite a few times as well, right?
Yes, and it may happen to the best of people as well. You may have done an anatomy scan, you may have had multiple scans, but some congenital heart diseases are very difficult to be picked up in the fetal period, and which we will learn as well through the course of the presentation. Also, during the presentation, actually, I'm going to talk about simple techniques which can be used for screening after the baby is born. Something
Hmm.
as simple as pulse oximetry, and we'll look at the importance of that, which can be done by any level of training. You don't need to, even be certified, but just know how to put the pulse ox properly on the baby and then interpret it accurately. And that has really shown great value in picking up congenital heart disease. So we'll also talk about that during the presentation.
It's a great tool, I have to tell you. I mean, I remember when it was kind of introduced as standards for us midwives here in Florida, using it, in an out of hospital practice, I'm talking now, and it changed. Dramatically, what we could see, and how quickly we could take action as well if we saw something wasn't quite right. So I'm glad that was introduced too, and it is quite a great tool also because it's not that expensive. It's not, as you mentioned, you don't need, to have an extra certification. It doesn't need to be done by a physician or doctor. You can pretty easily do it, and and it's not a big, expensive machine. So I think it's
Yes.
a wonderful, wonderful tool to use as well.
Yeah, one of the papers actually quoted that the cost of pulse oximetry is lesser than newborn heel prick, which is done for newborn screening or hearing screening. If you combine
Hmm.
or if you compare it to any of these methods or the amount of money spent with those kind of screening, pulse oximetry is cheaper than that.
Oh,
So
that's
isn't that
that's a
wonderful?
surprise. Yes, it's I
Yeah.
didn't know that.
Yeah, it is. Yeah, there is a nice paper which has quoted that. Yeah. Yeah.
Beautiful. Well, I think I had a little sneak peek, I have to tell here, full disclosure, of your presentation, and we talked about it, and you give us quite a good overview about anatomy, what to look out for, So it is, I have to say, it's a wonderful presentation. It's going to be a wonderful presentation. It's a little bit more advanced, that because you're a neonatologist, but that makes it special because I feel like I'm going to learn and learned from what I've seen so far, some new little areas, tricks, and tips of what we can really take into our practice and use, with the families we serve.
Yes, thank you, Christine. Thank you.
Well, thank you so much. It has been such a pleasure sitting down here with you, chatting and talking about the new presentation here at Gold that you'll have with us for the add-on package. And again, the title is Critical Congenital Heart Disease, a Guide to Screening and Management. And that's again part of the lecture pack, Comprehensive Care for 6 Newborn Challenges. And this is for our viewers. Now, if you are curious what the other 5 newborn challenges are, we invite you to go to Gold Learning and find out more about this wonderful lecture pack and add-on pack, and also goldmidwifery.com. We get started in February with the live conference. Of course, all the presentations for the live conference are also recorded and available on demand as well. And I hope you check it out and be part of this amazing experience here at Gold. So thank you everyone for watching. And again, thank you so much, Dr. Gayatri Jape. It was a pleasure having you.
Thank you, Christine. Likewise. And thank you to Gold for giving this wonderful opportunity. Thanks.
Thank you to all our viewers, and I hope to see you at the conference. Bye bye, everyone.
Bye, everyone.